Hi, I am Warashon from BCOS Clinic, Bangkok, Thailand. In the previous video, we have been guiding you through general information about sex reassignment surgery. In this video, we'll provide you detailed information on general requirements for the patients who wish to apply for the surgery. Through our step-by-step guideline, you will learn about everything you need to be qualified for the surgery. BCOS Clinic is careful and thorough in everything we do to ensure the highest level of the patient's safety and best surgical results. Accordingly, our team of board-certified surgeons and nursing staff help set standard guidelines for those who wish to apply for the surgery. The following section summarizes our general requirements and scheduling procedures. General requirement for male to female sex reassignment surgery. As SRS is a life-changing transformation for the patients, we ensure that it is strictly carried out according to the highest international medical standard and Thailand's national requirement. Therefore, in order to go under the surgery, the patients will need to have the following qualifications. First, the patient must be at least 18 years of age. Patient under 20 will need to have parental consent to go under the surgery. Patients must have been diagnosed with one of the following disorders: gender identity disorder, gender dysphoria, or associated conditions. Patients must receive a certification from a qualified psychiatrist, psychiatric social worker, or clinical psychologist stating that sex reassignment surgery is suggested as a treatment for their gender dysphoria. Patients must have been taking female hormone replacement therapy or HRT, or taking anti-androgens for at least 1 year. In the case that such therapy cannot be undertaken, patients must provide medical documents to prove that they have medical reasons which prohibit them to do so. Patients must have been living full-time in their preferred gender role or real-life test for at least 1 year. Please note that certified documents are requested to prove the stated qualifications. You'll find more details about them in the following section of this video. Now, let's talk about the patients who are not recommended to go under SRS surgery. First, patients who are diagnosed with schizophrenia, body dysmorphic disorder, and have unclear or confused thinking about how they live their lives. Patients who are infected with sexual transmitted disease such as syphilis, herpes simplex, chandroid, condyloma acuminata, and are not completely cured as these diseases can cause infection after surgery. Patients who suffer from chronic health conditions such as heart and lung disease and their doctors do not recommend or allow surgery. Patients who have weak immune system, take high steroid doses such as post-organ transplant or autoimmune disease, or have HIV and have a low CD4 count. They should receive treatment until CD4 count or viral load reaches normal level before going under operation. Required documents. If you wish to apply for SRS surgery at BCOS Clinic, you will need to submit the following documents. Referral document issued in your country. Referral document must be original and signed by a qualified psychiatrist in your country. It must contain information which confirms that the patients have been diagnosed with gender identity disorder, gender dysphoria, or associated conditions. Sex reassignment surgery is recommended as treatment for the patient. The patient has undertaken female hormone replacement therapy or anti-androgens for at least 1 year. If the patient is unable to undertake such therapy, the document must state medical reasons describing why it is not possible to do so, and that the patient has been living full-time in her preferred gender role for at least 1 year. If the patient is unable to live in such manner, the document must state reasons describing why it is not possible to do so. Please note that this will only be accepted in the case that the patient lives in a country where RLE or RLT is not possible due to legal or other related issues. Referral document issued in Thailand. According to the Thai law on regulation of sex reassignment surgery, the patients also need to have a referral issued by a local psychiatrist. This can be done before the surgery when the patients arrive in Thailand. Please note that if you cannot obtain this document, B-Cost Clinic will not be able to proceed with your surgery. The referral must contain the same information as those in the referral issued in your country. Health certificate. To ensure safe and convenient sex reassignment surgery, the patient must take a complete health check within 3 months prior to the surgery. The official health check report must contain personal information such as birth date, height, weight, and personal health records. It must state that the patients are free from serious diseases such as heart disease, uncontrolled diabetes, hypertension, and that they are fit to undergo a surgery under anesthesia. The document must include results of the following blood tests: complete blood count, urine analysis, fasting blood sugar level, HIV, electrolytes, alkaline phosphatase, aspartate aminotransferase or SGOT, LDH, PT, PTT bleeding time, creatinine, BUN test. And include the following reports: electrocardiogram, in case the patient's age 30 years or older, chest x-ray, passport. Lastly, a copy of your valid passport is required as your personal identification. When you have all of the required documents ready, please submit them to our email address displayed below. After our team of surgeons review your documents and conclude that you're eligible for the surgery, we'll then start scheduling your operation. In general, you will have to wait for at least 1 month for the surgery after it has been scheduled. However, this highly depends on the availability of our surgeons and our facilities. Therefore, it is highly recommended that the patients schedule their operation as early as possible. In the next video, you'll learn about different surgical techniques and their special requirements for the patients. See you later. Goodbye.